We're going to start in person, and Bill Yelenak, the Providers Council.
Good afternoon. Good afternoon. Chair Kennedy, Chair Livingstone, members of the Joint Committee on Children, Families, and Persons with Disabilities, thank you for the opportunity to provide testimony in support of House Bill 223 and Senate Bill 130, legislation that would provide a livable wage to community-based human service workers by eliminating the pay disparity that exists between them and state employees with similar job titles and functions. My name is Bill Yelenak, and I'm the President and CEO of Providers Council, the state's largest association of private, community-based human services organizations that provide a variety of services to hundreds of thousands of residents on behalf of the Commonwealth. I'm thankful to be before you today to discuss a pay disparity that has created a two-tiered system of care in Massachusetts and exacerbated a workforce crisis in the community-based human services sector. Direct care workers, nurses, clinicians, and others in this sector often receive a salary that is significantly lower than those working at state-operated human services programs due to low salary benchmarks being used in rate setting. This legislation would eliminate that pay disparity. We greatly appreciate the legislature's historic support of human services and of Chapter 257, the landmark rate-setting law passed unanimously by the House and Senate in 2008. Additionally, the legislature in its FY25 budget included a provision mandating EOHHS do a report on the pay disparity between community-based workers and state workers. This report was sent on July 2nd to the House and Senate Ways and Means Committees as well as EOAF. We've included the full report in our written testimony, which I believe you have, and it details the disparity in the following ways. The state sets the benchmark for a Direct Care 1 staff member in the community-based human services sector at just $20.79 an hour, yet the state pays its similar worker, a developmental services worker 1, an average of $23.51 an hour, or 13% more. Similarly, the Direct Care 3 job makes just more than $27 an hour, while the state role makes $31.25 an hour, a difference of 15%. State-employed social workers are paid on average between 11% and 47% more. State-employed nursing assistants, LPNs, and RNs receive between 1% and 16% more, and other positions have larger salary gaps, including OTs, PTs, psychologists, and speech-language pathologists who make, on average, 37 to 58% more working for the state versus the community-based sector. Our members will provide further testimony on how this impacts their workforce and the consumers to whom they provide care. This is also an equity issue. Nearly 80% of the workers in our sector are women, and 36% are people of color, percentages that far exceed other sectors. Our inability to recruit and retain workers can put lives and families at risk. This legislation being heard today would eliminate this pay disparity gradually through July 1st, 2029, at which point it would be completely eliminated. We'll file more comprehensive written testimony on these bills, which were reported out favorably by this committee last session. I'm happy to connect at your convenience to discuss this in more detail. Thank you for your time today, your continued support of human services, and of course, your consideration of this critical legislation.
Thank you so much, and thank you. I realize I didn't mention in the beginning, but thank you for setting the standard that we will have a 3-minute time limit for testimony, so you nailed it right on the head to set the tone for today. So thank you so much. Are there any questions with the committee?
Thank you.
Thank you so much for your testimony and the additional written you'll provide.